Good evening, everyone, and welcome to tonight's presentation. We are experiencing some technical difficulties, so if you will just hang in a couple of more minutes, we'll get started. Thank you for being here, and give us just a few minutes. Thanks. All right, let me pull it up.
We'll figure this out as we go, but for right now, we can get started at least.
Just mute really quick. Hi, everyone. We're back. Thank you for staying with us for our excellent Parent Academy tonight, Teen Drug Use in 2021, Understanding the Risk and Your Anxiety. We are very happy to have Dr. Michael Wittkamp back with us this year. He presented last year at one of our Parent Academies. He is a pediatric critical care physician at Children's Hospital right here in Colorado Springs in our community. He's also assistant professor of pediatrics at the University of Colorado School of Medicine. He grew up a Navy brat, and so he's very familiar with our military community. He is from the South, like me, although he went to the University of Tennessee and I went to Clemson, so we won't go there. But anyway, he just has a wealth of experience and has a really good presentation planned for us tonight. So we will give him a warm and hearty Academy District 20 welcome. Thanks, everyone.
Good evening, everyone, and thank you so much, Martha, for the introduction. So, we're just pulling up the presentation, and we'll get rolling. Thanks for your patience this evening. Okay, good. All right. Sorry, the fun of life in virtual. Thank you again. Thanks for having me back this year, and for those who attended last year, there will be some new information updated as much as possible. We'll go over a few other things, and as time provides, we'll have questions at the end. Before we get started, if I can just for a moment have your indulgence and say thank you to our entire community as we've worked through such a tough year in the face of COVID-19. I know this has been a challenge for everyone, for those who've lost loved ones, for those who have had such terrible financial pressures, and just in general the loss of community. So hopefully you can bolster yourselves to see it through the end, and hopefully this is the year that we can return to some semblance of normal. So until then, if you have these, please keep using. I think that's fantastic. And then as vaccine becomes available, please consider it for yourselves and your family. Please stay safe out there. Again, we'll be covering some topics on teen drug use with some emphasis on opioids, which tends to be of great interest to many families, since there is such heavy talk about an opioid crisis within our country, but also how it affects our teens. We'll try to put that in an idea of scale that isn't meant to scare, but hopefully inform, encourage you to continue great relationships with your kids, and maybe find resources that allow you to make for better days. I have no particular financial relationships or disclosures to make as we proceed with this talk. Discuss some of the limitations in teen drug use data currently available because of the limitations of this year. We'll understand the role and function of opioids within proper use of medicine and why they're in our communities in the first place. Discuss particular aspects of the developing adolescent brain that really make kids more susceptible to some of the issues that rise with drug use. Hopefully some better understanding about the concept of teen opioid epidemic as it exists within the United States. Put special emphasis on the rise of synthetic opioids, especially fentanyl and carfentanil. And then we'll talk about some other important drug ingestions that our children are at risk for at the current time, and some of the outcomes that go with them. Unfortunately, this year, the data is not as good because COVID-19 has interrupted so many things, and it interrupted the most important study that's used yearly for being able to understand really teen drug use in general, which is the Monitoring the Future report that often comes out. Only about 25% of the usual participants were able to be captured this year, which made the data pretty weak, but it fell in line with some of the good things that we've seen in the past. So looking at the limited data, just to cover some things, please don't forget vaping, and I know there's an upcoming session that will cover the risks of vaping. What an important subject for us to continue to think about, both for adults and teens as we move forward. The vaping rates have held steady. I won't say that's a good thing, but at least it's not more. Marijuana vaping rates have also held steady. This is another major risk. If we have time, we can touch on that. Marijuana use is used steady in general, but it does remain high. Alcohol use continues to fall, which is a real upside of things. We're at the lowest levels of teen alcohol use in decades. Hopefully that's something that continues to be seen in this data. And we've also seen a small increase in the use of prescription amphetamines, another thing that's creeping back in, and also likely related to the rise in the greater use of methamphetamine, especially in the adult communities. So in looking at this, if we look at any illicit drug use for 12th graders in the past year, it's about 38%. Any illicit drug use, not including marijuana, 11.5%. This is roughly unchanged. Again, it's hard to get excited about numbers that say that our children are at risk, but not seeing it rise is excellent. Now, this is blunted information since we weren't able to collect all the data for the year. And the worrisome part is partial data sets that have been looked at really showed that with the onset of COVID, with folks sheltering at home, there's been a sharp increase in use across most groups. We haven't been able to capture that in teens as well. Anecdotally, I would tell you that that probably holds true in our community just from the numbers that we've seen come through the emergency department and to our ICUs and to the psychiatric centers in the area for abuse and overdose. The marijuana news is that it continues to be used quite heavily. I don't think that's going anywhere anytime soon. I know this could be a controversial subject, and there's many thoughts about what is the safety of marijuana, what are the dangers, and there are many different positions have been held. There's some new data coming out of Northern Europe, which has been an area of very liberalized use for years, that's starting to suggest that routine and habitual use, especially at younger ages, does show a predilection towards increasing psychosocial dysfunction in a lot of users, which is a scary thing to start to see, that those liberalized countries that were using it so heavily are actually starting to think about pulling back and forming limits because of some of the damage they're perceiving after decades of data collection. So that's something to really kind of keep in mind. The upside, and this tracks from last year and reflects last year's data, overall, the idea is that opioid prescription drug abuse is down in teens. And this is a fantastic thing, but it comes with an asterisk, which will cover really the other dimensions that go with this. Though they are not using prescription drugs anymore, there is a small rise in teens among available street opioids. I know people's mind turned directly with that phrase, opioid to heroin. We're not looking at that, but we are looking at issues with fentanyl-based illegal sources, and we're going to touch on that in coming slides. So, again, the good news overall is teen alcohol use is at historic lows. Tobacco product abuse has dropped steeply. The problem is that we keep seeing it replaced with vaping. So the likelihood is that nicotine use is really probably at static levels when you look at the delivery systems that kids are opting for. The great hope is that we can chip away at that vape use, and with that, maybe nicotine will finally continue to come down. Also, as we look across things, we've seen less drug use in adolescence despite products becoming more available. That is to say, in the larger adolescent community, that fewer are using, and that's fantastic. We'll talk about the risks, the dangers of death that come with the use of the available opioids, though, because we have seen what seems to be a very sharp increase in death as related to these medications. The exciting thing, though, is teens seem to have some insight about the risks and dangers linked to narcotics in general, that when questioned in the reports that I talked about before, they realize that this is a high-risk behavior. And hopefully this is the beginning to understanding, and hopefully a motivation to steer away from these items. Well, the bad news is deaths are on the rise. There's a similar curve that is out that also comes from incomplete data that comes up through 2018. What you see is this is overall national deaths from drug ingestion. And as you can see, it just takes off quite furiously from 2014 on. And the major driver, as you can see by the little green triangles, that's the synthetic opioids that are starting to flood the market. The availability has just become widespread, and we'll talk about why that seems to be driving deaths. So I think it's always good to start so that we all have the same terms and terminology and understanding about what we're saying, because a lot of terms are used interchangeably and can get confusing very rapidly. So when we talk about opiates and opioids, opiates are substances that are derived directly from opium poppy. So We're talking about things that I think people have heard about over time. Morphine, codeine, and heroin itself come directly from that poppy. Opioids, though, are partial or fully synthetic compounds that were really developed for medical use. These are the ones that have really hit the news over the years, and OxyContin and hydrocodone being such a major feature of the rise of opioid abuse throughout 90s and 2000s and even into today, but even more so being supplanted by things like fentanyl and then carfentanil. Now, narcotics, even though that gets used as a really imprecise term from a medical standpoint, but even in referring to the substances, and really falls into use within governmental and legal terms, and is used within DEA drug classifications. It doesn't offer us a lot of good information about what we're talking about. So most of the time I'll be talking about opiates and opioids throughout the evening. Why do we have these in the first place? Well, I think it's probably apparent to most. It's to treat pain, and that's really what they're there for. Pain is such a complex phenomenon, a very personal phenomenon, and something that needs to be treated as we've moved forward in medical care. Over time, the complexity of invasive medical procedures and the extension of life with chronic diseases really necessitates these for quality of life. So they do have a very important role. It's not something that we can go out and just wipe out. It's the misuse that we really want to be looking at. They're powerful and they can be effective in the right setting, but they really require close medical monitoring and personalization of the management of these medications over time. The difficulty with opioids are they may be effective, but the body builds very rapid tolerance, and addiction for those who have a tendency towards addiction in the first place can come on very rapidly with escalating doses, and this is where we see many problems arise. Chronic users will continue to need higher and higher doses or higher and higher potency medications to achieve similar effects because of their tolerance. One of the things that really makes this difficult is we still have a deficit in physicians that really specialize within good pain management and use and understanding of these medications. It's been a hard area of growth within medicine because it's a high burnout area, as one would assume. Working with people day in and day out that have chronic pain can be very draining, both on that patient but also the provider. So it's been very slow to build. It's such a great need. Historically, these have been around for a very long time, since the beginning of recorded text 5,000 years ago. That this is a substance that was recognized early for both its good properties, but also abuse potential. Amazing to think the historic texts talk about abuse of these medications. In the U.S., we've seen several waves of actually opiate and opioid crisis over time, but this is the first opioid wave that's really affected our youth, and I think that's the thing that makes this such an important subject for us to keep visiting. Our current crisis really came out of the 80s and early 90s, and what I can tell you is, as someone who went through medical school in the 90s, the message that was coming out was that we were under-treating pain, that pain needed to really be a focus when we met with patients, and we were told this, that we had a new generation of drugs that were going to be safer with excellent potency, that were going to be able to help people with pain, and that we'd been taught incorrectly that that addiction wasn't such a large problem, and that we needed to be first and foremost making sure that we address the pain that patients had. As we've seen unfold in the past 10 years, this seemed to be untrue and maybe had issues with corrupt practices within the pharmaceutical industry, which is sad to see. Even though as lawsuits go through and reparations are made, the reality is that we still have the after effects that we're going to be working on for quite a long time. In recent years, we've had huge programs on drug diversion and re-education of physicians, which is starting to change practices. But the other problem is that we've left a full community of patients that were physiologically dependent on these substances and started drawing back. Drug cartels are built for profit, and they know that there are people who need and want these drugs to be distributed, and so that's filled the void. That's why we've seen this huge rise within the synthetic illegal opioids at this point, and they're really near pharmaceutical grade replacements. They've completely flooded the market and have supplanted that original illicit prescription drug market that was seen, and now we've moved into fully illegal replacements that have come into the community. And touching on potency, when I refer to that, what we're talking about is the dose of an active drug that's needed to achieve a particular effect. So if it's to relieve pain, how many milligrams of certain substance do I need to achieve that? The implications for that come down to understanding how strong some of these medications may be. In medicine, what we talk about for opioids is understanding the equivalency when we talk about morphine. It's our best known and still very often used medication within the hospital setting. So as you can see, the potency ratio there in that one column is equating it to a morphine. So as we go from morphine, we move up the column there and we look at heroin, 1 to 2 times the potency of the medical grade morphine that I might be administering to patients. We take the next step up, and hydromorphone will be better known to most of you as Dilaudid, a very important pain medication, but also sought after drug on the street as well, 5 times as potent as morphine. And then we move to fentanyl, and this is why fentanyl has taken center stage as such a risk to our communities, 100 to 200 times the potency of morphine. That has implications across the board, from the ease of which it can be concealed and moved in significant microgram amounts and still not take up very much volume, but still supply so many people with the illegal drug. In looking at opioid overdose, what would you be looking for if a family member or someone you knew was being affected by these medications? This graphic hopefully puts it in a decent kind of cartoon way to digest it. The things to emphasize: unresponsive, extremely slow breathing, sometimes measured in the single digits per minute. It can be choking and vomiting. Maybe airway obstruction that you hear is gurgling or snoring. It can feel cool to the touch, and when you look at their eyes, their pupils will be very small. You may see blueness to the lips and nails because of how shallowly they're breathing. They're not getting enough oxygen. All these are emergent signs that someone may be affected by opioids. Please call for help in these situations. Please call 911. These are people that are at risk for dying in front of you. Hopefully this helps people know what they may be looking at if they come upon someone at home or out in public that may be unresponsive. This would be important information then to share when you call in on 911 to say, I do worry that there may have been a drug ingestion or opioid ingestion. So what about our teenagers? Why do we worry about them being exposed to these medications? What happens? And the concern is, with research over the years, is that teenage brains may actually be wired for addiction. That's not to be dramatic. It's to say that we have to respect that the human brain is a very plastic and evolving organ, and over our lifetimes it changes, or we hope it changes. We go from the impulsivity of toddlers who grab at anything and don't see limits, to slow maturation into understanding the right and wrong, and things like property and other tough concepts, really, when you think about it conceptually. The thing is, as we move into our teenage years, our brains are evolving very rapidly, but they're not fully adult brains. They tend to have even more impulsivity present. The graph that you see in front of you looks at percentage of past year initiates. So what we're looking at is, when do people start their drug use? And it may be in some people's minds, well, it's the first time it's out there, so that's when they jump in. But as you can see, that spike 14 to 20, but then a sharp drop off as people move into their 20s. This is why I would argue it's not just about availability. Anybody in their 20s could very easily obtain substances. But it's those teenage years when the idea of trying new things, having new experiences, really sets up the reward centers of the teenage brain, and they have a tendency to act impulsively and engage. So it's not that they want to do these things, it's partially a programming issue of the brain at that point, that it's even harder to resist temptations and new and shiny objects, if you want to think of it that way. So we know that adolescents behave erratically at times, and they are set up for increased risk-taking, which is part of going into adulthood. It's realizing limits and being able to understand what risks really do represent potential harm and which risks are things that allow a person to grow. When we talk about adolescents, they're drawn to those novel experiences, and they show a really strong response to new sensations and new stimuli. That's from self-reporting on scales that say how much did you enjoy that, to even what we call functional MRIs that can look at areas of the brain that light up when certain just concepts are introduced to teenagers. So they tend to have a strong focus on acquiring items and experiences they desire. That's part of that drive that is ongoing in these years. So when we think about what's the model for this, again, young children, it's so easy to reward them because just even little abstract things make them happy. I always relate it back to my own children when we needed to get them to make their beds and clean their rooms. What can you do? Yeah, give them a little star sticker to put on a chart, and that's enough to keep them happy. But the reward center of the brain in an adolescent is less affected by small and what they see as meaningless rewards. They want stimuli that activates that reward center just strongly and in ever increasing magnitude. So, and this comes right at a time when that more mature part of us as adults is still being formed, that executive decision-making center that helps us say, you know, that's not a good idea. It's not fully there. And in fact, it continues to be immature even up to 30 years of age, and even older in some folks. So it's important to understand it's a developing brain that's being challenged by all these incredible experiences that life has to offer. Unfortunately, one of those experiences may be introduction of drug use. What we know, and is tied into that, and to further emphasize it, is the earlier the exposure, the better prediction for long-term abuse. Certainly this is an older study, but this has been borne out in others. You can see the earlier the age, and that's what's being indicated at the baseline there, then what is the estimated prevalence of lifetime prescription drug abuse. You can see the earlier back it starts, the higher that column is for each of those for concern for drug abuse at later ages. The early introduction in that brain that's still developing forms tracks and associations that may last a lifetime, and that's why it's so important that we're on the watch with our kids and having open conversations, making sure that we can hopefully help guide them or get them help if they're starting down a particular road that may continue to introduce these things to them and put them at risk for later dysfunctions in life. These are further graphics that echo that, age at first use and then later risk for ongoing disorders. So alcohol abuse, again, we see the earlier it starts, the more likely it is to be a problem in life. The same thing with marijuana use disorder. In that meaning, and again, not to raise what may be a controversial subject for some, especially within our Colorado communities, that marijuana can be a problem. I know that we all know folks who use habitually, and it blunts them from being able to participate in life fully, whether that's employment or interaction with family members. It is a real thing. So looking at that, the earlier the onset of use, the more likely it is to be a continued issue throughout life. So what are these risk factors that we think of for high-risk substance abuse? And just going down the list, I don't think a lot of these will be surprising to folks. And these are things that I think that we've talked about for years. Certainly a family history of substance abuse. Yes, there's a genetic component towards addiction. It needs to be realized, it needs to be talked about among family members and communicated that we are an at-risk family. We need to be careful, and you need to be careful with the substances that you may encounter in life because there'll be a predilection. Favorable parental attitudes toward the behavior. It's great to be able to find experiences for your child so that they can expand, but there's just certain behaviors that if we say yes to as parents, it gives them the go-ahead. Again, these are forming brains that don't have their own ability to know constantly this is the right way to go, this is the wrong way to go. And no matter how much you don't think your teen is listening to you, they look to you. They're cueing off of you for what is the right behavior in these situations. Poor parental monitoring. This can be difficult. We don't want to be intrusive in our teens' lives as they grow in autonomy, but at the same time, we need to be present and be able to ask open questions, not in a policing sort of manner, but definitely one that's hopefully an open conversation that allows them to feel open to approaching you if they have issues. Parental substance abuse. This may be something that many don't want to admit, but your own problems that you may have, that you may think you have hidden. I think most of us know. Households are small, families are tight, and people know when something's afoot. Your kids know from an early age on. So it's very hard to hope for children to have proper modeling if you have a continuing issue yourself, and it does become such a major family issue. The same thing that we're all told when we're kids, you are who you hang out with. Association with substance using peers. Peer pressures is a very real and strong thing and can be part of that initiation into use. I've highlighted the next one, lack of school connectedness, because that's where we are this year, and one of the reasons that we probably anecdotally, and when we finally have the numbers, are seeing increased dangerous risk-taking abuse of medications at home by children. School is a place where teens can have some autonomy, but at the same time there's structure, there's peer groups, positive peer groups that help them. It's a place to relieve anxiety, and unfortunately, because of the disruptions this year, our children don't have access to that. So remember, that's a really strong current right now within that teen population. Low academic achievement, not because of them not being good at school. No matter how much a child says they don't care, they do care. They want to do well. It can lower self-esteem, and it makes them just that much more likely to look for an out, look for something that helps relieve that anxiety and those low feelings that they have. Sexual abuse, which often doesn't get talked about, but is more widespread than most of us realize. It needs to be uncovered because many of those children, because of their scarring and the PTSD that goes along with that, seek things to blunt those horrible feelings that they have, and puts them at high risk. Mental health issues that can go unrecognized at a time when it may just be written up to regular teen behavior. When depression, when bipolar disorder and things of that nature are not being recognized, not being treated properly, self-medication is often one of the avenues that are pursued. And then lastly, family rejection of sexual orientation and gender identity. Again, I know in our community it can be a controversial issue, but please be there to at least listen to your children. Again, no matter how much they say they reject your stance as a parent, they look to you for approval. That rejection by you causes a great amount of stress, anxiety, can cause very negative feelings. And again, we see much higher substance abuse rates that occur within those teen populations that are dealing with these issues of identity. So this is a slide to take a look at what really are the risks when we talk about these separate pieces. So if we're talking about major depression, anxiety disorder, and panic disorder, how much more of a risk is that population for starting opioid use? And as you can see, that's an odds ratio being listed, saying that almost 4.5 times in peer group then. to begin using opioids. We move across a familial alcohol problem, drug use, meaning probably an underlying genetic predisposition towards addiction and the constant stressors that go with potential use within the home, almost 8 times as much as peer group. And then PTSD leading to drug abuse and dependence, almost 8.5 times more. These are very real stressors that come up in life, and again, it can be hard to find good psychiatric care at times, or know how to access that, or even recognize that somebody needs it. But this is why it's so important for early recognition and referral. I guess the other question is, why do teens use? And we always say, oh, they're just experimenting. At least in this one study that we look at from 2012, it may actually be used to relieve pain, and we'll get into what that means as far as pain. It may be in their minds a legitimate use of this because they have pain that isn't being treated. Now, the important thing to remember is we learn to manage pain throughout our lives, and we learn to manage pain by looking at adult behaviors. So if teens are in a household where somebody does have chronic pain issues and it's not really discussed how severe that pain is and why controlled substances are necessary for controlling it, it may just start to become one of those things that pain requires pills. I should be able to take them too. Maybe that's part of the thinking that goes into it. Really important to talk to teens about approaches to pain, both non-pharmacologic and more basic. But as you can see, 48% of those teens that misused opioids, meaning that they took opioids that were not their own, 48% of them said it was to relieve pain. Now, 52% said, I was experimenting, I was wanting to get high. Now, when we look at that, what are the risks moving forward for repeated use in those groups? If it's unprescribed pain relief, even though it's treating pain, those who are drawn and make that decision to misuse those opioids for unprescribed pain relief end up almost 2 times at risk compared to their peer group for having ongoing opioid use disorders. Recreational use increases thanks to almost 3.5 times their peer group. So this is very real, and why it's important to ask a larger why. If you find your child using, don't jump to any kind of judgment or accusation. Really try to get to the bottom of what may have been the driver for that, and make sure that they can get the right referrals to the right people so that the underlying problem can be addressed, instead of just deciding very rapidly that it's for that recreational use, or because they're just being defiant. There may be underlying pain that needs to be addressed. Where do adolescents get their opioids? Despite what we'll talk about for street drug availabilities and things of that nature, over half of the respondents greater than 12 years old say that they got their opioids from a friend or family member. 40% say they were given opioids for free from that friend or family member. That is to say, again, our medicine cabinets are still the major source for teens acquiring opioids. We need to be aware of that. And as we'll talk about, securing those medications is so important. It takes away the temptation, it takes away the availability. So in talking about a teen opioid crisis, what are we talking about? Because as we said, the overall opioid use in teens is actually in decline, at least has been up until this year. Teen perception for the danger in of use in this is on the climb, which is a good thing. They understand that these are dangerous. Perceived availability of opioids is actually in decline, meaning that they think it's actually harder to get hold of them. All of this should have brought about then hopefully a decline in deaths related to use. But instead, what we've seen is a 3-fold increase in adolescent and young adult deaths as ascribed to opioid use over the last decade. So really what's going on, and when we look at it, our teen opioid crisis is simply our nation's opioid crisis. It's a reflection of what's happening in every age group, really. You can see across this graph how over the past 2 decades, we've seen unbelievable increases in deaths per 100,000 as caused by drug overdose deaths. So the question would be, does this mean all drugs? This takes another look at what are we looking at as far as numbers. And in 2016, 65,000 deaths. The next thing to realize is 2019 to 2020, and this study closed just 3 months after COVID hit, we were up to 81,000 deaths nationwide near drug overdose. We can only imagine that may have gotten worse during our COVID crisis. Hopefully we'll have numbers on this going into next year to understand the impacts, but just understand it continues to increase. The real driver behind it is these synthetic opioids, and we'll look at some graphs behind that. But what about in Colorado? Where does this rank as an overall cause of death for teens in our state? This is available off of a public website that tracks total deaths within the state on almost a daily basis for every age category. You can just simply find it, click on it, and it will rank it for you. And as you can see in the 15 to 24 category that I think we really need to look at, what are our top 3 causes? We always talk about motor vehicle collisions, but you can see that ranks as number 2. As many of you know, teen suicide and adult suicide within our state, and especially within our county, are extremely high. And as you can see, that is the #1 cause of death within that 15 to 24 age group. So let's keep that in mind as well. But number 3 on that list, poisonings, and what they mean by that and what the CDC means by that when they list it, that's drug overdoses for the most part. These aren't accidental poisonings for the most part. These are intentional overdoses and unintentional overdoses taken by that person. This is extremely impactful for all the fears that we have on any given day for our kids and the specters of various illnesses. It still comes down to 3 things that fall into the category of preventable death that we really need to do better as a community to protect our kids. So what's driving it? It's not heroin. A lot gets talked about the rise of teen heroin use, but that's an extremely minuscule number at the end of the day for 12 to 19-year-olds. That's not where it is. It's extremely sensational to show the IV drug use gear on television specials and on the news, but that's not the driver for this. For our region, even less so. Heroin's mostly a problem in the northeastern United States. Our western regions actually have some of the lowest heroin-associated deaths for adults and for kids. Most teen opioid use is through controlled prescription drugs, so diverted prescription drugs, and then overall opioid use down from 6 to 10% of 12th graders to 1 to 2%. Again, we should be celebrating that this has gotten better. So why are we looking at record high numbers of adolescent deaths as related to drug overdoses? Over half of those are associated with opioids, and that this is a really impactful number to remember. For every 1 young adult overdose death, 119 emergency room visits and 22 treatment admissions go along with that. Not for that individual, but across the community. When we start to count it that way, these are staggering numbers when it comes to need for resources and use of resources. So the factors that contribute to the deaths in teens, it's the combining of opioid use with other drugs. Alcohol and sedative medications compound opioid effects tremendously and increase the risk for death because of that. Also, the recognition that prescription drugs purchased from dealers are more than just maybe counterfeit, they're most likely counterfeit. You know, in some areas, and even though I have down below certain percentages, in some areas there's estimates of Percocet, a very well-known and popular prescription pain medication that is often abused. Upwards of 70 to 90% of that may actually not be Percocet at all. It may actually be fake pressed pills that are mostly made up of varying amounts of concentrations of fentanyl. In some areas, 20 to 30% of the illegal prescription drugs sold as Xanax, and Adderall. So benzodiazepines for relaxation, Adderall, a stimulant, even those are cut with fentanyl at this point. It seems to be everywhere in the street drugs that are available, and it's important for that to continue to be broadcast to people that what you think you're getting is not what you're getting. You're more than likely getting high concentration fentanyl, and thing. Record number of U.S. overdose deaths reported in mid-2020 corresponded to the onset of COVID-19. Yes. It's the disruption of daily life, the isolation, and the increased anxiety and depression we've seen, all the social and financial hardships that have come about, and then simply the boredom that's probably driven most of that. So we can't really step away and forget what a modifier that this disease has also been on top of our ongoing drug abuse. And then there's the rise of fentanyl. In the last decade, illicit manufacture has gone through the roof. This used to be diverted drug from medical source. Now it's fentanyl that's being produced mostly in Mexico and China. The fentanyl sources are low to middle purity out of Mexico, but growing. And the Chinese source fentanyl is extremely high purity. It allows them to ship very small volumes to dealers here in the country that can then process it and resell it. They're difficult to control just because of the sheer volume that is out there, and because of the ways that this can be shipped without detection. This is what I was referring to before, and I think important things to know. So if you hear the phrase perk 30, this is a popular meme, especially among teens and young adults, a phrase that gets used. It shows up in popular music, various references. But Percocet 30, which was one of the most commonly used prescription pain control medications, you can see the real ones on the right. On the left are the fake ones. I think any of us would be hard-pressed to be able to make out the difference between them if we were staring at them, and especially you're a 15-year-old, you're a 16-year-old, somebody passes you that and says, here, it's just Percocet, don't worry. Because what they perceive is, since it's a medical drug, since it's a prescription drug, there must be built-in safety to it, knowing that even the real thing can be dangerous. The thing to realize is about the fake pills, it's pressed fentanyl, it's not Percocet, and it may be in high concentration. The cartels have taken to pressing their own pills because they know the popularity of basically to think of it as a brand name on the street, and they sell more if they can package it that way. What I can share are anecdotes this year of multiple teenagers that have come in. One that when he woke from a 2-day coma told me that he had called his dealer like he usually does, took 2 of his perk 30s that he usually takes, and that's the last thing he remembered. That's not to condone his use. That's to say, this is a teen who thought he was experienced in this, and it almost ended in death for him had not a friend called. More sadly, it was a 16-year-old girl that unfortunately experimented for the first time with friends and some young adults. That didn't end well for her. She ended up dying from asphyxia from the overdose. And then there's the issue of suicide. There's some recognition, and I shared this last year. There's been no finalization in this study. A bit disturbing, and I think a great question that was asked are, how many of these things that we call accidental overdoses from drugs, actual intentional suicides? There's some suggestion in this one regional study that it could be up to 1/3 of the things that we've deemed drug overdoses may actually have been intentional and may actually be intentional for the sake of suicide. There's such a combination of the mental health issues that are in our community and the crossover into the drug issues that we have. We need to be aware of this and really be looking at drug use behavior. May not just be for the use of drugs, but it may be one of those kind of approaches closer and closer to the line, but finally just taking a little too much so that they don't have to take what they think are more extreme steps. The result is the same. It's a loss of life. So what can you do as a parent? I'm not going to share anything that's going to be earth-shattering. It's going to be the same things that are always suggested. And I think even though they're common, they're hard to do. As a father of two teenagers, open discussions are sometimes difficult on any given day because of the distractions that are around. And asking us as parents to be open and non-judgmental, that can be a heavy thing to carry some days, because what we want to do is protect, and sometimes our way to protect is to really be quite dismissive of behavior and turn to punishment instead. It really requires you to be open and listen. That's a challenge to all of us as parents. Being able to ask them directly about their knowledge on these topics, not just engage them about what they're doing, but even in your younger children, asking what do they hear around school, what have they seen. This is important because this is a time when impressions are made, and if they're hearing the wrong thing, this is your chance to intercept, give the facts, and allow them to form the right ideas around these issues. If you're not able to culture that sort of relationship with your child, we need to be ready to do a very difficult thing, which is allowing them to maybe engage with another trusted adult that they can confide in, someone they can turn to when there is a stressor in their life, or they may be at a point of a difficult decision. Maybe a family friend, it may be family, it may be a school counselor or clergy. All of these are important people to allow our children to interact with, because if we can't be there to supply what they need, let's at least identify another responsible adult that we can trust to help guide them. Things that don't help, and this has been proven through studies, don't interrogate. Policing at home isn't going to work. That causes alienation. Invasion of private spaces, room searches, and things like that. There may be situations where that arises when you are working with trained professionals, but that's not something to undertake within your house. In random home urine drug testing, all of it comes with judgment. The first instinct of a teen, and especially a teen that may be fighting with impulses, with other issues underlying, is to hide, is to push away, is to draw them further from you. So be very careful about that. You don't want to undermine the trust that you have, because it's that trust that you're going to build on that allows you to hopefully make the interventions that need to be made. Easy physical things to do. Lock up your medications. I can't say that we're always great about that in our home. We don't have a lot of prescription meds, but even over-the-counter medications can turn dangerous. If you have the capability of doing it, and especially if you think you have an at-risk teen, or even on another subject, curious toddlers and curious grade schoolers, please get them into a safe place, somewhere they can't get to them. Throw out your old prescriptions. The tendency of so many people, especially in times that seem uncertain, is to start to hoard old pills. I'm sure many of you can think about it right now. There's a closet somewhere that's got old antibiotics and maybe old stores of painkillers that you said, better not get rid of it, who knows when I may need it. It's dangerous because they go forgotten, and then they become discovered one day and become part of experimentation, and that's when accidents happen. If you have a known opioid abuser in the home, consider keeping naloxone or Narcan available. It may be the difference between losing that family member to an overdose. Some resources to look into. If your child's suffering from an injury or has a pain issue, this may seem kind of foreign to folks. Engage the physician treating and talk to them about a reasonable and scaled pain plan. Hopefully opioids aren't necessary. Most of our kids have injuries that are going to be treated just fine by using some ibuprofen or Tylenol. If opioids are offered because it's a post-surgical issue or maybe more intense pain, it's okay to say, why don't you give us maybe just 4 of those, or enough for 2 days. Ask for limited prescriptions. The fewer chances you have of having multiple pills in the home, the better. It helps reduce exposure, and it reduces availability. It's such an important thing. Voice your concerns to your primary care physician. Screening for substance use and other behaviors is supposed to be an important part of annual physicals. I challenge a lot of you. I think sometimes it's easy as a parent to go, well, my kid's out past that time, they need immunizations. They don't need a physical, they don't need to go in. The other part is not just the physical, but it may be a chance for a health professional to be able to look for issues that may be underlying, not just substance abuse, but mental health risks that may be present and other psychosocial stressors. It's very important to continue to pursue annual health care for your children if possible. Websites that can help: the National Institutes for Health, the National Institute for Drug Abuse. You can see the link below. It has multiple educational resources for parents and adolescents regarding opioids. It allows you to bone up on the facts that you need, and also make sure that you have it straight before you begin talking to your teens. Society for Adolescent Health and Medicine, also excellent links, and also has some references for counseling for peer and family support. And then Substance Abuse and Mental Health Services Administration does have a treatment locator for mental health and opioid abuse, also an important one. And lastly, and most importantly, if you're somebody who keeps the Poison Control Center number at home, I would tell you to keep this number right next to it. Make this a part of conversation for families in this day and age. Being able to reach out and ask for help and hopefully prevent suicide, make that resource available, and please pass that along to friends. And let me just check with some folks. How are we doing for time?
We're doing great. 6:57.
Fantastic. Just a few things I want to touch on that are outside the realm of all the talk that we've had about teens and opioids. We were about the young as well. We see young children who get into pill stashes, to parents' medications constantly. Please help us avoid that. Again, lock up the drugs. Never underestimate a young child. They will find whatever you've hidden. You've proven that on Easter egg. It comes at Easter, and they will do the same thing. If you think you've hidden your pills at home, they will find them. Intentional overdoses are not to be overlooked for younger children. We're starting to see self-harm and suicide in kids as young as 8 and 9. We don't have a lot of warning signs for them. Don't leave the tools out that may end up with a bad result from an impulsive behavior. And looking at psychiatric drugs in the home, again, we look at them as prescribed, and they're good drugs because they're helping somebody. We see an awful lot of psychiatric drugs as part of the cocktail in overdoses. If they're yours, keep them in a safe place, keep them away from the rest of the family. If it's your teen that's on psychiatric drugs, though you want to give autonomy, that might be a joint operation. Maybe the time for medications being given is a joint effort between you and your child, and you keep the medications in a safe place. It's important to, again, avoid those opportunities. I am going to speak to Benadryl overdose, such a benign thing. I'm sure most households have this. I hope most of you know that Benadryl overdoses we see constantly. I haven't revised this slide from last year, but I would estimate that I see anywhere between 3 and 5 severe Benadryl overdoses a month. Several of these have almost ended in death at this point. Now at this point, 5 patients that have had life-threatening cardiovascular complications from this. Something seemingly benign, or as kids take as a goof for tripping on Benadryl, it's dangerous. We've had a few deaths as related to it, and then a lot of near fatalities from it. Don't underestimate the power of over-the-counter medications. And also, I'll mention at a time of legalized cannabis, remember that it's still illegal for minors. 50% of our teens admitted for psychiatric issues are positive for cannabinoids, and 60% admitted for severe overdoses are also positive for cannabinoids. The THC vaping devices are dangerous. They're mostly illegal. They're not regulated. We have no idea what are in them. You have the risks of vaping combined with an unknown amount of THC in the cartridges often. Please be careful about that. And to up the ante, there's a growing percentage of those cartridges that have been laced with fentanyl just to add to the danger. And unfortunately, I hate to report that methamphetamine's on the way back in too. We're starting to see increasing amounts of stimulant use, and even more so combinations of methamphetamine with crystalline fentanyl and what causes a speedball effect, highly dangerous and potentially lethal. Be aware that these are back in the community now, and you would be able to. So thanks for your time. I hope we do have some time for questions. I'll tell you what I know and what I don't know. It's such a difficult subject to cover, but I do thank you for making time for it. And again, thanks for letting me be part of your evening.
We have some questions.
Great, I'm going to read them aloud as we go. So, without random drug tests, room searches, electronic searches, how would a parent become aware of drug use? I think that goes back to it, and some of you may laugh and say it's useless. It begins with conversation, and if the relationship's broken enough that there can't be conversation and there's concern, it's time to go in and see a professional. The random searches and things like that may allow you to discover, and it'll give you short-term gains, but that's the reason that it's advised against. Long-term, the eroding of trust may make it so that there's higher risk behaviors that follow on after that. I'm not going to speak to you as a drug treatment professional. If you have approached drug treatment professionals and that does become part of the regimen that you institute, it's because you are working with a drug treatment professional. And in that case, it may be appropriate. So I hope that answers it, and I promise I'm not dancing around the question. There's also one, does the drug unit in health class, I'm sorry, they might be giving me so. Drug unit in health class causes curiosity in different drug experimentation. I think this is something that we want to believe is that if we don't introduce it, it's not going to be discovered. I think what you'll find is if you start asking early, and I did this with my own kids, I'm really lucky I have 2 great kids, but I started asking them about what they knew about drugs at age 8. Already at that point, they had heard things at school. I don't think it's the drug education units. I think it's the culture that they're in, either directly from peers and even more indirectly just from the messaging that comes across popular media and things like that. Its presidents talked about, they're introduced to the concepts. It's better that you're able to intervene at home and have the discussions that you want to have. And hopefully that marries up with what's done at school as well in providing good information from trusted adults about what is present and what should be a concern in their lives. So I wouldn't have negativity about those important educational units in school. I think they're important to make sure that we're introducing good, healthy discussion about that at an early point. I don't think at all that it impacts experimentation. That happens independently of any education that we've ever put out. It says, can we share the links again? They'll be posting of the talk, I assume?
Yeah,
at a later date?
we're not sure what
Okay.
slide that was on.
Okay, we can 100% please. Yeah. So that'll be available to you as far as the links that are out there. There are many others. The one thing that I would caution is if you're looking for substance abuse links, when you go on and you type that into Google, most of what you're going to be seeing, look at first to be objective information. They're actually ads from various drug treatment centers. And I'm not talking bad about them. They do wonderful work in the right context, but understand that you are looking at ads, despite the help that they also offer. There's also competition between them. So really take a good look at what you've got there when you are looking at information that you've pulled up on Google. It's hard to tell these days the difference between an advertisement and an objective informational source. So please take a close look. Okay. They're going to try to post out the PowerPoint, and hopefully that'll be available at some point. But again, I really do appreciate everyone who took time to listen in this evening. Thank you for your questions. The big thing that I'd stress is parenting's not easy. Again, parent of 2 teenagers and a pediatrician. and I still have questions most days. So I think it's a conversation to be had with peers. Please turn to folks that may be able to offer better information. Working with your primary care physicians can be a great way to start conversations and get referrals. Sorry, a little feedback. And also, don't forget the resources that are available through your schools, especially through some of the excellent work that's done through District 20. The parent nights are only the tip of the iceberg of some of the great work that goes on for providing for our children's health on top of their education. So big thanks to the staff that takes care of that on a constant basis within our school district.
Thank you all for being here tonight, and a very special thank you to Dr.
Just a second, Martha.
Gotta love and trying to do these things through these big platforms. Yes, thank you for being with us tonight. A special thank you to Dr. Michael Wittkamp. He is such a great presenter and does amazing things at Children's Hospital right here with our youth. This recording will be made available on the Parent Academy page of the ASD20 website. It takes about a week for us to do everything we need to do to get it up there. So if you have any further questions, you can certainly email me, martha.hinson, Hinson, @asd20.org, and I can seek to get the answers for you as the health and wellness specialist here in the district. Thank you again. Our next Parent Academy is in 2 weeks on Tuesday night. I believe that's the 26th. And Dr. Piatanita from UC Health will be sharing about vaping and what we need to know as parents and how we can help our kids with this. Thank you so much. Have a wonderful week. We appreciate you being with us. Good night.
Thanks, y'all.